Picking a Medicare plan can be like a puzzle. There's a lot of info out there, and knowing what's right for you is tough. First, you must figure out when to join Medicare A and B. Then decide if you need a supplemental or an advantage plan and which drug plan is the best fit. But mistakes can happen with so many companies, prices, and paperwork. Those errors might cost you penalties or land you in a plan that doesn't cover your needs. Now, sure, many folks are saying they can help, but sometimes it feels like they're just trying to sell you something. Amid all the ads and phone calls, it's easy to get lost. But here's the good news. Medicare doesn't have to be this hard. Hi there. I'm George Holmes, co-founder of the MedicareAcademy.org. We believe there's a friendlier way to handle Medicare. And for over 10 years, we've been helping folks get a clear picture of Medicare before making choices. We've helped over 250,000 people, showing them the ropes of Medicare. So coming up, I'll break down when to enroll, how to avoid the big medical bills, and the main differences between the types of plans. Plus, I'll share tips on choosing the right drug plan. By the end, you'll have a clearer view of Medicare and feel more at ease with your choices. And guess what? Our expert team at MedicareAcademy.org is here to help you with questions and paperwork. And that's right, all of this guidance won't cost you anything. So let's dive in and make sense of it all. Everything starts with that important Medicare card, which you'll get when you join Medicare at 65. Let's simplify Medicare. When you reach your 65th birthday month, Medicare becomes important. If you need health care during this time and you're still working at a place with 19 or fewer employees, your work insurance won't be the main payer. Medicare will. That means you should sign up for both Medicare Part A and B. It usually doesn't make sense to keep only your work insurance after joining Medicare. If your workplace has 19 or fewer people, know that your work insurance will only help after Medicare has paid its share. Now, on the other hand, things are different if you or your spouse are still working at a larger place, say with 20 or more employees. Here, your work insurance pays first and Medicare is the backup. That's why many still working at big companies might delay joining Medicare. They rely on their job's insurance since it covers more. But what happens when you decide to retire or find the job's insurance isn't as good as Medicare? If you're older than 65 years and 4 months and haven't joined Medicare yet because you or your spouse were still working, there's a different way to join called the special enrollment period. This process isn't the same as the regular way to join. This special way has two main forms, the L564 and the CMS 40B. The L564 form shows Medicare that you had work insurance since you turned 65. The CMS 40B is simpler. It tells Medicare when you want your coverage to begin. If you're saying goodbye to your work insurance in June, you'd use this form to ask for Medicare to start in July, for instance. Best to sort this out about 2 to 3 months before you end your work insurance. Now, once you're all set with Medicare Part A for hospital stays and Part B for other medical services, you've got choices for extra coverage. There are two main paths, but you can only pick one. The first is to stick with original Medicare and maybe add a supplemental plan to cover what Medicare doesn't. The other, introduced in 2003, is called an Advantage Plan. It's a different way to get your medical benefits and was introduced as another option for people. If you decide to stay with original Medicare, it has two main parts, Part A for hospital care and Part B for other medical services. Now basically, Part A covers everything related to inpatient services. This includes being admitted to the hospital, nursing services, room and board, and all tests billed by the hospital. This falls under Part A of Medicare. Part B of Medicare is for everything outpatient related, in addition to all physician services. All doctors included and involved in inpatient or outpatient services are paid through Part B. This includes ER doctors, surgeons, anesthesiologists, primary care physicians, specialists, and other outpatient professionals. There's no premium for most individuals for Part A. For 99% of people, Part A is free. This is because most have paid Medicare taxes throughout their working lives or their spouses. As long as one has a record of 40 quarters or 10 years of work, there's no premium for Part A. Regarding the financial specifics of Part A, our first primary expense is a deductible, referred to as the Part A deductible. When hospitalized, your responsibility for this deductible, which covers up to a 60-day hospital stay, regardless of whether your stay is 1 day, 10 days, or up to 60. This deductible is your only financial responsibility. Now, this deductible is unique compared to what many are familiar with. This deductible is tied to a benefit period. When admitted to the hospital, a benefit period begins. For example, if admitted and discharged 7 days later, this benefit period extends to another 60 days post-discharge. During this period, if re-hospitalized, you are still under the initial deductible and benefit period. However, if you need to be re-hospitalized after the 60-day period post-discharge, a new benefit period begins, bringing another deductible. For instance, if you had pneumonia in February and were hospitalized, and then later in December you broke a leg and required another hospital stay, you'd face the Part A deductible twice within that year. This system is based on benefit periods. For hospital stays exceeding 60 days, a daily copay of $400 is charged for the third month. This copay doubles for the fourth and fifth months. Extended stays, while rare, can be costly to you due to these daily copays. Now, lastly, Part A also covers skilled nursing facilities, which are essentially inpatient rehabs. If someone has had a stroke, a fall, or a surgery like hip replacement that requires extensive rehab, they may be admitted to these facilities. Medicare stipulates that if you were in the hospital for a minimum of 72 hours before entering the skilled nursing facility, then Medicare covers all expenses for the first 20 days. If the stay was shorter than 72 hours, Medicare won't cover any cost. After the initial 20 days, the daily copay applies for the next 80 days. Currently, the average stay in these facilities for Medicare beneficiaries is around 30 to 35 days. Now, most individuals typically spend between $2,000 to $3,000 out of pocket. This main coverage under Part A is hospitalization and skilled nursing. Now, moving on to Medicare Part B, almost everyone has to pay a premium for it. Those who qualify for Medicaid due to very low income and assets might receive assistance in their Part B premium. However, the majority pay a Part B premium. This premium can be deducted from your Social Security check, billed quarterly, or paid monthly through a bank draft system known as Medicare Easy Pay. The Part B premium is determined by your income with two different schedules, one for single filers and another for couples filing jointly. Now, as of 2024, they consider your modified adjusted gross income from 2022, always looking back 2 years. If you file single and 2022's income is $97,000 or less, you'll pay a premium of $174.80. For couples, if the combined income is $194,000 or less, both partners will pay $174.80 each. If your income exceeds these limits, you'll face an additional charge known as an IRMA, Income-Related Monthly Adjusted Amount. Now, this surcharge applies to both Medicare Part B and Part D. However, about 90% of people fall within the standard amount. If retirement causes your income to change, you can file a Form SSA 44 with your local Social Security office, and you will be able to adjust or eliminate your IRMA charge down to the standard rate. Now, there's a Part B deductible. Unlike the Part A deductible, this one only applies once a year and resets every January. So if you join Medicare on July 1st, you'll be responsible for the deductible for that year. And then it resets the following January. Now, currently, the government has not released the 2024 Part B deductible numbers, but in 2023, it was $226. After reaching this amount, Medicare covers 80% of approved expenses, and you're responsible for, remember, the remaining 20% known as coinsurance. While copays are flat rates, coinsurance is a percentage. Without additional insurance, your 20% share could be potentially limited. This can become problematic, especially when considering doctor's fees, where you'll pay 20% for every doctor you visit with no cap. Lastly, there's a chance you might visit a doctor that adds to the Medicare bill. Although 90% of doctors accept Medicare-approved amounts as full payment, 10% might add additional charge. This maximum they can add is 15%, termed as what's called excess charge which patients must cover. So to summarize, while original Medicare offers a significant coverage, there are still serious financial responsibilities associated with Part A and Part B. So consequently, many individuals prefer not to bear these liabilities. Individuals often opt to transfer these liabilities to an insurance company, whether in part or in full. In return for a premium, the insurance company provides them with a Medigap policy, also called a Medicare supplemental plan. These terms are interchangeable. There are 10 such policies available today. Now, while there isn't time to delve into each, 3 are the most popular. These policies are represented by specific letters of the alphabet: Plan F, Plan G, and Plan N. However, the majority can no longer purchase a Plan F due to its gradual phase out. For clarity, if you were born before January 1st, 1955, and thus began Medicare before January 1 of 2020, you can still purchase and retain Plan F for life. You were, in a sense, grandfathered in. Those born after January 1st, 1955, and starting Medicare after January 1 of 2020, you cannot access Plan F. Now, turning our attention to today's most popular plans, Plan G stands out. The Plan G supplemental plan covers 5 of the 6 essential gaps, leaving you responsible only for the Part B deductible. And once you meet this deductible annually, the G plan covers the rest. There are several essential features of any supplemental plan. Number 1, supplemental plans have no networks. Unlike Medicare Advantage plans that do have specific networks, supplemental plans do not. This flexibility allows you to visit any doctor, hospital, or provider. If they accept Medicare, they will honor your chosen supplemental plan. And number 2, no referrals required in supplemental plans. While Advantage plans often require a primary care doctor referral to see a specialist or access certain facilities, this isn't the case with original Medicare. If you need to see a specialist or visit a facility, just make the necessary arrangements. There's no need for a referral with original Medicare. Number 3, no pre-authorization on Medicare supplement plans. Pre-authorization is when an insurance company must first approve a procedure, a test, or admission recommended by the doctor. With a supplemental plan, as long as your doctor recommends it and Medicare covers it, there is no pre-authorizations to worry about. You can proceed with the needed service. Lastly, supplemental plans are lifelong. So once approved, you'll only have to pay the premium in advance every month. The insurance company must fulfill their obligations as long as Medicare provides. These plans can only be canceled if you fail to pay your premium. If you miss a payment, you'll typically have 30 days to settle that amount. If you don't, then the policy can be terminated. They cannot cancel your plan due to your age, claim amounts, or relocation. Supplemental plans are portable, offering the same coverage anywhere in the country. Now, diving into the specifics of these plans. Supplemental G plan covers all gaps except the Part B deductible. The second leading plan in today's market is Plan N, as in Nancy. With the different structure, it offers a lower premium. By opting for this, you take on more financial responsibility. Like Plan G, you'll cover the deductible. However, if there are any excess charges, you must handle them, unlike Plan G, which covers these excesses. Only about 10% of doctors charge this excess fee today, but it's still a factor to consider. With Plan N, each doctor visit comes with a $20 copay. An emergency room visit has a $50 copay. The plan means lower premiums, but added liabilities. Plan G and Plan N are the primary supplemental plans available, and it's essential to choose what fits best for you. For both plans, there are no networks, no need for referrals, no pre-authorizations, and they're written for life. Now, there are 4 crucial points to understand. Number 1, consistent coverage. Now, whether you opt for Plan G from ABC Insurance or from XYZ Insurance, the coverage remains consistent. One company won't offer more extensive or different coverage than the other. Plans are federally regulated and standardized, ensuring equality no matter what you purchase or where you purchase. Number 2, networks. Always remember there are no networks. Medicare is universal. Any provider accepting Medicare will acknowledge your chosen supplemental plan. Number 3, claim. Concerning claims, we don't need to file any. Present your Medicare A and B card and supplemental card to your provider. They handle the claims process. Medicare settles first, then the remaining balance is directed to the supplemental company, which takes action based on your acquired plan. Number 4, customer service. Now, being brokers with access to various carriers, we've observed that the difference in customer service among them is pretty minimal. You might have an excellent experience with one call and a less satisfying one with the next. However, the overall service level remains comparably across the board. We pride ourselves on personalized customer service. While you have the option to contact the care providers directly, we also encourage you to reach out to us. For assistance. Our customer support team is here for you, valuing you not just as a number, but as a respected client. Now, whether you choose ABC Insurance Company or XYZ, the 4 fundamental aspects remain consistent. However, there are 2 distinctions worth highlighting. 1, the initial premium. Your initial premium for the plan is by age, gender, region, or zip code, and tobacco use in certain states. While Medicare dictates the plan's structure and rules, the individual private companies set the premiums. Most companies generally lock in a premium for the first 12 months before the potential rate increase. Number 2, stability of premiums. Not all companies offer the same rate stability over time. While I can't predict exact rates for 5, 10, or 15 years into the future, we can refer to a company's historical stability over the last decade. All rates will increase due to Medicare or medical inflation. All rates will increase due to medical inflation, but some carriers have more frequent and significant hikes. While discussing options, we prioritize rate stability. When you transition to Medicare, whether it's 65, retirement, or if you prefer it over your group plan, you must be aware of an important period related to your Part B start date. You have a 6-month window from this date during which you can select any Medicare supplemental plan available in your state without health underwriting. This period allows you to apply 3 to 6 months in advance. During these 6 months, companies must accept all pre-existing conditions. After this period, this guarantee doesn't apply. It's essential for those with health concerns to understand these nuances. Now, regarding the plans, many opt for Plan G or Plan N supplemental. But there's another option, the Advantage plan. Now, these plans function differently and serve as replacement. Advantage plans have provider networks. Some are HMOs with fewer choices, while others are PPOs with a broader network. Providers are more attracted to PPOs as they tend to offer a better compensation. You're generally restricted in your network with HMOs unless it's an emergency. In contrast, PPOs grant more flexibility to step outside of the network, although staying inside the network is more cost effective. So remember, in contrast, Original Medicare does not bind you to a network. Medicare is straightforward in its approach. If you're wondering whether your provider accepts Medicare, you only need to ask them directly. However, with certain Advantage plans, it's crucial